Welcome, everyone. Today we will be discussing an essential public health topic, improving cancer screening rates in Stark County, Ohio. My name is Samantha Helmkamp, and I'll be presenting with Mindi Weiford. This presentation draws from Healthy People 2030 agenda to advocate for early cancer detection, highlighting the importance of addressing disparities in our community. Let's begin.
This slide outlines our presentation. We'll start with an overview of cancer screening as a Healthy People 2030 leading health indicator, followed by a look at Stark County's data in comparison with state and national averages. We'll analyze an infographic, examine current policy and advocacy efforts, and introduce a key person of influence. Finally, we'll conclude with lessons learned and implications for healthcare systems.
Cancer screening is a critical component of Healthy People 2030's goals, aimed at increasing screening rates for breast, cervical, and colorectal cancers. The rationale is straightforward. Early detection significantly improves patient outcomes, reduces advanced screening diagnosis, and lowers healthcare costs. Unfortunately, disparities exist, particularly for rural populations who face challenges such as limited access, higher costs, and awareness gaps. Stark County's screening rates fall behind state and national averages, underscoring the need for targeted intervention.
Cancer screening involves tests and examinations to detect cancer at an early stage when treatment is most effective. However, systemic issues within our healthcare system, such as cost and access barriers, significantly impact screening rates. For example, uninsured and underinsured individuals often forego preventative care screenings, increasing their risk of late-stage diagnosis.
Here we see how our healthcare system affects screening on the individual level through the decisions to pursue screenings, the interpersonal level through family and encouraging others to partake in screenings for cancer, organizational through local clinics who offer screenings and other resources, and through the community levels through health resources. The policy level is to help ensure access to preventable screenings.
This slide highlights the importance of cancer screening for reducing mortality and addressing disparities. Challenges specific to Stark County include lack of insurance, transportation issues, and gaps in public awareness. However, there are resources available, such as programs by the Ohio Department of Health and local foundations, which can help address these barriers.
This slide highlights the importance of cancer screening for reducing mortality and addressing disparities. Challenges specific to Stark County include the lack of insurance, transportation issues, and gaps in public awareness. However, there are resources available such as programs through Ohio Department of Health and local foundations which can help address these barriers. Many residents in Stark County face challenges with health insurance coverages, including being underinsured or entirely uninsured. Residents also lack reliable vehicle and public transit options to reach screenings and treatment facilities, especially those in elderly and underserved areas. Awareness campaigns in Stark County have been less effective due to the limited outreach of underserved areas, particularly among minority and low-income groups. The Ohio Department of Health will offer community-based initiatives to improve access to preventative screenings. The Prevent Cancer Foundation provides transportation grants to support cancer screening access in underserved areas. And the Altman Health Foundation provides a local program to offer educational outreach and preventative care services for Stark County residents.
Currently, cancer screening rates in Canton, a city within Stark County, are below national goals. Low-income and minority populations are disproportionately affected, facing barriers like economic hardship and limited healthcare access. The consequences of inaction are dire. Higher rates of late-stage diagnosis will strain healthcare resources and exacerbate health disparities.
This slide highlights serious challenges that Canton faces with late-stage cancer diagnoses. These diagnoses often come with higher treatment costs and lower survival rates, creating a significant burden for both patients and the healthcare system. For individuals, this means worse healthcare outcomes and reduced quality of life. For the community, it leads to deeper health disparities, particularly among underserved populations who already face barriers in accessing preventative screenings. Limited screening access prevents early detection, which is key to improving survival rates and reducing costs overall. Addressing this issue is crucial to reducing strain on the healthcare system and ensuring better health outcomes for Canton's residents. Later in the presentation, we will be exploring solutions such as expanding access to screenings and addressing healthcare inequities.
Efforts to improve screening rates in Stark County include public health initiatives like awareness campaigns and low-cost screenings offered by local health organizations. However, these initiatives are often underfunded or inconsistently implemented. While the Affordable Care Act has improved access to preventative services, systemic barriers persist, highlighting the need for robust community partnerships and sustained funding.
Ohio House Bill 371 passed in 2022, and it mandates insurance coverage for annual mammograms. This policy is a significant step forward as it addresses financial barriers to breast cancer screening. Early detection is not only here to save lives, but also reduces healthcare costs by preventing advanced stage treatments, which can be more costly. While supporters, including women's health advocates and medical organizations, celebrate this progress, some insurance companies still have raised concerns about its costs.
Kirkland Norris plays a vital role in improving health equity in Stark County. As the health commissioner, he oversees programs and sets policies that directly impact cancer screening rates. An advocacy letter addressed to Mr. Norris outlines barriers and proposes solutions, such as introducing mobile screening units to reach underserved populations. This initiative could significantly reduce late-stage cancer diagnosis in the county.
Community involvement is crucial for improving cancer screening rates. We encourage everyone to participate in screening programs and advocate for policies that ensure equitable access for all. Advocacy starts as a grassroots level. Talk to your friends, family, and local representatives to push for change.
Our research emphasizes the systemic disparities in cancer prevention and the need for targeted interventions. Preventative care not only improves patient outcomes, but also reduces long-term healthcare costs. Nurses, in particular, have a pivotal role in advocating for these improvements, bridging the gap between policymakers and community needs.
This slide lists the sources that informed our presentation, ensuring our data is accurate and up to date. These references include guidelines for the American Cancer Society, local health assessments, and state policies.
Thank you for your attention. By addressing these disparities in Stark County and beyond, we can work towards a future where everyone has access to life-saving cancer screenings. We welcome any questions or comments.